Hello everyone and welcome to AnimalWised. In today's video, we're going to tell you everything you need to know about vaccinating cats. When we adopt a kitten, we want to do our best to help them live a healthy and happy life, so preventing disease is essential. Why is it important to vaccinate a cat? Following a vaccination schedule is the best means for animals to obtain immunity from viruses and bacteria. Immunity is partly transmitted from the mother to kittens through breastfeeding and the placenta, but this immunity lasts around 20 to 40 days, after which the kittens are once again at risk. In order for maternal immunity to be effective, it's important that the mother has also been properly vaccinated, dewormed, and well fed. After this first period of immunity, the veterinarian will determine when to vaccinate the kitten, generally around 7 to 8 weeks of life. The kitten will need to be dewormed before they are vaccinated. When the kitten first arrives at the clinic, a complete examination will be carried out. It will be useless to vaccinate an already sick cat, as the purpose of the vaccine is to stimulate their immune defences against a possible disease, but if these defences are already fighting another disease, they may not work against those the vaccine is trying to combat. Such a situation won't be harmful to the animal, but it won't be effective either. After this first checkup, the vaccination can proceed with a small injection, a potentially stressful but not painful procedure. Side effects of vaccination. A fleeting 24-hour malaise could occur, meaning the day after the vaccination, the cat may feel a little apathetic, a little less active, and lose some appetite. If you notice symptoms more severe than this, you will need to contact the veterinarian to determine whether this is caused by the vaccination, or there may be another problem affecting them. Is it necessary to revaccinate the cat? When we vaccinate a cat for the first time, it is as if the feline immune system has received the first part of the necessary information, but not enough to be complete and have lasting effects. Therefore, the kitten will need a second dose, generally after 3 to 4 weeks, for the vaccine to be effective for the following 12 months. For this reason, it's important to follow the vaccination schedule recommended by veterinarians. If, for some reason, we are unable to vaccinate the kitten during this time, we will have to initiate the procedure all over again. How often do we need to revaccinate the cat? It will depend on what the vet tells us. It is normally every 12 months or a little longer, depending on the vaccine used and the geographic region in which we find ourselves. Types of cat vaccines. There are 3 main types of vaccines for cats, and once again it will be the vet who will decide which one to administer. Generally, it will depend on the geographical area in which we live, the respective laws, and habits of the animal. Here we talk about feline combination, feline leukemia, and feline rabies vaccines. The feline combination vaccine. As its name indicates, the feline combination vaccination includes vaccines for rhinotracheitis, herpes virus, for calcivirus, and for panleukopenia. The latter is a type of viral gastroenteritis which causes stomach pain and diarrhea with a high mortality rate. It is a viral infectious disease and is very easily transmitted in areas where there are large concentrations of cats, such as shelters or colonies. Feline rhinotracheitis is almost always caused by the feline herpes virus and/or calcivirus. The disease is transmitted among cats by direct contact. In case of herpes virus, replication occurs in the nasal, tracheal, and conjunctival mucous membranes. Symptoms include sneezing, conjunctivitis, blepharospasm, hypersalivation, and coughing. And finally, calcivirus affects the respiratory tract of the cat, causing lesions in the oral cavity, giving rise to fever and moderate depression accompanied by poor appetite. The most serious infections of calcivirus cause tongue blisters which evolve into ulcerations of the oral cavity, nasal itching, sneezing, conjunctivitis, and dyspnea causing high fever, pneumonia, severe anorexia, and death. There is a high mortality rate in very young subjects. Vaccine against feline leukemia. Feline leukemia is a disease which is fatal in the majority of cases. It is a form of cancer which is particularly common to cats. It is also a contagious disease which affects the immune system. The most obvious symptoms are progressive weight loss, appetite loss, fever, and pale mucous membranes. Feline leukemia affects young cats in particular. Cats between 8 to 9 weeks and 1 year of life are at risk. After their first year, the risks of infection decrease but do not leave completely. Cats living in large groups, cats in catteries, stray cats, and those with outdoor access are more at risk. In general, if the cat has only ever lived in the home, it is much less chance of getting sick. Some research claims the risk may be as low as 1%. Anti-rabies vaccine. Rabies is a disease which affects many animals, including humans. It is widespread over the world, but some areas are much more affected than others. It is transmitted mainly through bites and causes vomiting, excessive drooling, nervous system problems, and eventually death. Fear of water is another symptom of rabies. Whether or not your cat needs a rabies vaccination depends on where you live, so speaking to your veterinarian will let you know if it is required. We hope today's video has been useful to you. If you liked the video and want to know more, subscribe to the channel and have a look around. We'll see you next time.